Hey FreeBody family, Kat Matlock here at FreeBody in Asheville, North Carolina, where you learn simple skills and tools to get yourself out of pain and take your life back. So today we're going to cover what are the hip flexors anyway. Everyone wants to blame psoas for everything. I want you to understand that the hip flexor group is exactly it. It's actually a large group of muscles. So let's dive right in. What are the hip flexors? So I'm going to break down all the muscles that are primarily hip flexor muscles and those that also support hip flexion when needed. So let's talk about first, what is hip flexion anyway? Hip flexion is what happens when you draw your knees toward your chest or you curl forward, the knees get closer to the chest. That means the hip joint is getting smaller, the angle of the hip joint is getting smaller at the front. So we'll start with the most famous hip flexor of all, the psoas, of course. The psoas going from the sides of the lumbar spine, diving through the pelvis, crossing under the inguinal ligament, and then diving with its best friend iliacus and attaching actually at the back of the femur, on the inside at the back of the femur, on a little spot called the lesser trochanter of the femur. So the psoas muscle gets a lot of talk. And what I want to say is, don't blame the psoas for what an entire group has going on, because the psoas is only one of many hip flexors. Yes, it pulls that femur bone up toward the chest, classic hip flexion. Yes, it supports your movement, but it also has the really important job of taking the weight of your body from one plane, one axis, and then where it splits and divides onto your two legs. So going from one axis to two axes, supporting your weight and movement. That's kind of a big job. So any of the postural muscles above and below that are in a fuss, the psoas muscle is going to be affected. So sometimes the things that we're feeling are dysfunctional in our bodies, it didn't start there. Often it's the end of the line or a reaction to some other dysfunction. I did a video recently on the three main reasons why hip flexors cause low back pain. The psoas is a big piece of that. I'll put a link in the description to that video because you'll want to check that out also. So let's get into psoas's best friend, the iliacus. The iliacus lines the inside of the pelvis and then joins the psoas as it crosses underneath that inguinal ligament in the groin and then dives deep into the femur. So there's a little spot right in the crease of the groin, just below it on the thigh, where psoas and iliacus are like conjoined twins, and they're diving in to grab that femur. That's a really important point. One thing to understand is that iliacus creates a big tilt in the pelvis, and it also contributes to rotation, whereas the psoas contributes to flexion, but also compression of the spine. If you're having any disc issues in your lumbar spine, you're going to want to check your psoas. If you're feeling like if your pelvis is twisted, or every time you get on the table with your chiropractor or your massage therapist, they're like, oh, your pelvis is rotated, you're going to really want to check the iliacus, because that's a big job of what it does. It pulls and rotates the pelvis forward and back. Iliacus also, its pain referral pattern is actually burning or aching or sensation on the front of the thigh. So you might think, oh, my quads are messed up. But actually, that could be your iliacus and the pain referral of iliacus right on the front of the thigh. I had a client once who had been in a car accident. She straightened her leg and slammed on the brakes and was hit head on by a car. And her iliacus and her psoas freaked out. And she was seeing all kinds of practitioners trying to get that burning and deep ache on the front of the thigh to go away. Once I released her iliacus, by the end of the session, that pain was gone. No one had addressed it. It had been over a year. So check your iliacus. I have a video on how to release iliacus. I'll put a link in the description below so you can check that out. Okay, now we're going to talk about pectineus. Pectineus is a little muscle with a Napoleon complex. It tends to get really tight, really dysfunctional. The pectineus muscle is an adductor, which draws the thighs toward each other or pulls the femurs toward the pelvis. Pectineus is also a hip flexor, and it actually is one of the prime hip flexors. Little muscle, big job, big attitude. Pectineus gets really dysfunctional and can cause groin pain, as well as contributing to hip flexor tension that you feel right at the groin, right at the front of the thigh that you just can't figure out. Years ago, I made a pectineus release video. You're going to want to check that out if you're having some groin pain with your hip flexor tension. And so I'm going to put that link in the description as well. Now, another primary hip flexor is the tensor fascia lata, whereas iliacus lines the inside of the pelvis and kind of pulls the front of the pelvis down and in like that. Tensor fascia lata, as you can see, lives on the outside of the pelvis, right at the front. It goes right into the iliotibial band, and it pulls the pelvis forward and down and creating hip flexion in that way. So forward, down, and out a little bit, iliacus pulling it in a little bit, little tug of war can happen between those two muscles. TFL is an interesting little muscle. I don't feel like it gets as much appreciation as it deserves. Tensor fascia lata can create aching down the whole iliotibial band and make that whole ache down where you're just like, oh, my iliotibial band is so tight. Well, yeah, high five. Iliotibial band should be tight. It's a stabilizing structure. But what creates the aching down the iliotibial band could actually be coming directly from your tensor fascia lata, or it could be coming from your gluteus minimus, but that's another video altogether. So TFL, I often release TFL and glute min at the same time because they're right next to each other. So TFL pulling that pelvis and attaching on the iliotibial band can create that radiating ache down the outer thighs. And of course, I have a video on releasing TFL and glute min on the floor. I'll link that video in the description below. Now, rectus femoris. Rectus femoris is another hip flexor. Rectus femoris is also a quadricep muscle. So when rectus femoris is right on the top of the quads, attaches right up on a lower part of the pelvis. The big bump that you can feel on the front of your pelvis is called the ASIS, anterior superior iliac spine. We're going to get to a muscle that attaches to that in a moment, and our TFL that we just talked about attaches to the outside of that ASIS. But right below it on the pelvis, as you can see in this picture, is the AIIS, or the anterior inferior iliac spine. And that's just a little spot on the pelvis for the rectus femoris to kind of grab onto and pull the pelvis and the thigh toward each other. So one of the quads, rectus femoris, is also a hip flexor. Now, rectus femoris can create pain in the knee. So if you're having, or make your knee buckle, or make it hard to go up or down stairs. So if you're having pain in your knee and some hip flexor tension, then you're going to really want to check your rectus femoris and release that. Of course, I have a video on how to release that muscle, and I'll link that in the description as well, with all the other videos as well. And one more hip flexor that I really want to talk about is sartorius. Now, sartorius grabs that ASIS, and then sartorius lines the inside of the quads, and then it attaches below the knee. It contributes to inner knee pain, and I did a whole video on the 3 muscles that attach right there in a spot called that pes anserine, sartorius being one of them. Sartorius pulls the front of the pelvis down and in a little bit, so another kind of inner rotation of the pelvis. Sartorius, also being a hip flexor, also bends the knee flexion, and also lifts that inner shin, externally rotating the hip. So it does a bunch of jobs. And sartorius, I find, is a big player in that inner knee pain, but also in hip flexor tension. And now here's a little secret. Even glute min and maybe even some of the anterior or front fibers of the glute med can also contribute to hip flexion when the need arises, or depending on the position of the femur relative to the hip. So that's a lot of muscles. You got psoas, you've got iliacus, you got pectineus, you've got TFL, you've got rectus femoris, you've got sartorius, a little bit of glute min and glute med, and I didn't even talk yet about the other adductors, adductor longus, specifically inner thigh muscles, adductor longus, and a little bit of adductor brevis. Go from the inside of the pelvis, attach along the inner shaft of the femur. Also will pull that femur toward the pelvis, but also in hip flexion. So my request is that you stop blaming your psoas for all your hip flexor tension, because anytime a muscle is dysfunctional, all the muscles that do the same job as that muscle are going to be thwarted or not allowed to do their job fully, because they're trying to kind of make up for what that first muscle isn't doing. As well, all the muscles that do the opposite action of that muscle are going to be affected. So in this case, when the hip flexors, when any one of those hip flexors is affected or has trigger points or is in some trouble, all the other hip flexors are going to have to do their job a little bit more, contract a little more strongly. Now, in this case, we have the adductors, the muscles that draw the legs toward each other. So hip flexor tension is going to have a result on the efficacy of the adductors, and that's also going to affect the abductors, the outer hip muscles, glute min and glute med. The same way one of the quads, rectus femoris, is also a hip flexor. Well, that tension is going to affect all the hip extensors, which is glute max and hamstrings. So you see, hip flexor tension is a piece of a big puzzle. You might be feeling the hip flexor tension on one side, but if you're just treating one muscle, never going to get better. If you're not looking at the whole puzzle, if you're not also treating at some point your inner thighs, if you're not also treating at some point your outer hips, if you're not also treating at some point hamstrings and glute max, you're not probably going to be able to get rid of that hip flexor tension. So I just wanted to kind of paint a bigger picture for you. One of the things I've seen in my more than 30 years and tens of thousands of people that I've worked with is that everybody wants to blame one muscle. It's my psoas. I have psoas tension. Or it's my piriformis. That dang piriformis is causing my sciatica. Maybe. But no muscle works in a vacuum. So check out those other videos that I'm listing. And in the next video, I'm going to give you a short practice that you can do that just gives some massage work to all of the muscles in this group so that you have the best effect. And it only takes about 5-6 minutes to do this short practice that I'm going to show you. I also did a video during one of my live sessions a while ago about want to release hip flexor tension, try this, and it's about releasing the hip extensors, about releasing the hamstrings and glute max, because hamstrings and glute max are pulling the pelvis tucked under, and that can be causing some tension in your hip flexor. So of course I'll put a link in the description to that. We got a lot of videos linked in the description today, but it's a big puzzle and no one thing is going to fix it. So I hope that you found this video to be helpful. I trust that you did. Kat Matlock here at FreeBody. Send a comment, let me know what you think. Send a request. I'm continuing on this request for someone who asked to understand more about the hip flexors, and then watch for that video to drop in a few days of a short practice to release all the hip flexors in the group. I'll see you next time.